Hey friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. Hello, friends. I have a friend here. This is Dr. Monica.
Hello. I'm so excited to be here.
Monica is my real friend. She's my real life friend. And this is Dr. Monica Tarantino. And let's tell them what we're doing. So we're not in the barn, obviously. We're in a hotel.
Yep. Downtown Nashville.
Yes. Why are we here?
We are here talking to our fellow veterinary colleagues, and we're talking about old dogs.
Yeah.
Which we love.
We're at Fetch Nashville. And we were at this conference last year doing the same thing.
Yeah.
So we're here for the second year in a row. Very excited. We had a packed house, couple of lectures today.
Yeah.
And yeah, we're talking about senior dogs. And Dr. Tarantino is, she's a veterinarian, has been for about 11 years. And you went to Virginia Tech to vet school.
Correct. Yep.
And practiced in Charlotte for a long time,
Yep.
right? Like
almost 10 years.
Almost, yeah. So you've been in the DC area, Virginia, the last couple of years.
Yeah, last 2 years or so.
And in Charlotte, you worked in GP and you were the
Chief of staff.
At
a really busy five
title.
Yeah, she's always like, you were the chief.
She was an
medical
important person at this
officer.
clinic. Chief of staff at a 5-doctor practice,
Yep,
GP.
in Fort Mill, South Carolina, which is right outside of Charlotte.
Yes.
Yeah.
And you have also worked in ER a bit, and now you're doing relief work.
Yes.
So relief GP work. Do you work in the ER some now or no? Just GP?
Not really.
Yeah.
Just GP.
Yeah. And part of the reason why we know each other and why you're here is because you are one of the co-founders of the Senior Dog Veterinary Society.
Yes.
Which if you don't know about, you're going to learn all about today in this episode, that's who we're here with for our lectures. You're also the co-founder of Pet Loss Community.
Yep.
Which is a really wonderful organization to help support pet parents going through grief and loss of their pets, which we'll talk about if we have time today too.
Yeah.
And then tell us about your roommates at your house. Who do you live with?
Humans
and animals.
My husband, Brent, who's also a veterinarian.
Uh-huh.
And then we have just a house full of dogs and cats.
We love it.
Yeah. Lots of old things.
We love
the old things. So we take care of them.
Yes.
And no human children. So our animals are our children. And yeah, it's a fun little house.
Lots of people watching and listening to this can relate to.
Yeah.
So I'm glad you're here.
Thanks for having me.
Okay, so let's talk about the Senior Veterinary Dog Society a little bit.
Yeah.
We'll kind of just jump right into that because that's why we're here. And I would love for you to just kind of share why you decided to push to start that, kind of inspiration for that. I know it's your dog that you had in vet school, right?
It is. Yeah. So I think it's interesting because you talk to a lot of animal lovers when you first kind of get to have your own pet or whatnot. Everyone always loves the puppies and they're always jumping up and down for the puppies and the young, oh, that's a cute little puppy. Mm-hmm. And then you can be like, I think what's so funny for the senior dog owners is like if you put a puppy on the corner with their owner and then you put a senior dog parent with their old dog that has like one eye, like a tooth that like comes out.
Who are you going to pick?
Yeah. And they're like old and arthritic and they're kind of their heads tilted or whatever. And people drive by, they're always like, look at the cute puppy, like blah, blah, blah. But for me, and probably
not I, says Monica and Molly,
that old dog, and we're going to be like, who is this? Tell us everything about this.
Tell me about the crust.
Yeah. Tell us about this crusty old thing. So I think, for me, obviously, I think the first time you end up having an old dog is when you end up really falling in love with them.
Yeah.
And that's what happened to me. So when I was in vet school, I had a Westie named Frodo Baggins Tarantino, and he was the love of my life. He was like my ride or die. And he was a healthy dog his entire life. And the story that I really tell is that when we were in vet school, he hit age 10. And as soon as he hit age 10, it was like we went from this dog that was never in the hospital except for these wellness visits and his annual vaccines and his dental cleanings whenever we had those. And then all of a sudden we went to a dog that we couldn't keep out of the clinic. So he was there constantly for something new every few months. And we were just like, what is happening? Like he's been healthy his whole life. So age 10 was like this point where like something like flipped, and he was really entering his senior years. And so we had things like, neck pain popped up for him and he couldn't move for a day or two and was kind of crying out. Then he had a collapsing trachea and a cough from that. Then he had a chronic cough that he developed that a lot of Westies can get as they get older. Just like it wouldn't stop coming. A mass on his spleen that I told you about.
Didn't he have a splenectomy at the vet school?
Yes, during my 4th year, during our rotation on what we call community
practice. I hope they
practice.
gave you a good discount in vet school.
They did because
good.
Brent actually did the surgery. So,
perfect. Good. Yes.
So they let the vet students practice.
Brent is a vet too. So that helps.
So when he became an old dog, it was this whole brand new experience, and I was not prepared for it at all. And it was so funny being at vet school surrounded by the brightest minds in vet medicine and in this environment of learning, and yet still feeling clueless when I'd go to talk to them about like this preparation and what you need to be getting yourself ready for when you have an old dog.
Yeah.
Because there's a lot that comes along with that.
Yeah. Yeah. We talk about vet school a good bit in our lectures when we're talking to vets and vet techs, because in vet school, we learn so much about medicine and diseases and what's happening in our patients and how all these diseases work. But I feel like most of what we're learning is just in the context of like an average age dog. It's not really in the context of what does this look like for a senior dog.
Yeah.
And there's a lot of diseases and different conditions and things that we look at them differently when we're talking about an older dog.
Yeah, absolutely.
And it's not necessarily even to the fault of the vet schools, I think, I think we both really hope that that's going to change as the study of aging becomes more prevalent and popular. But it's, vet med is slow to catch on to these things. So in human, I mean, what are the geroscience?
They've got geriatricians, gerontologists. They've got all sorts of.
This is a big thing in human. I mean, you all know everyone's biohacking and talking about how can we live longer as humans? How do we figure that out? And so we're limping along here in vet med.
Yeah.
We'll come behind, but you're a part of that.
Well,
right?
We're a part of that. And what's really exciting right now is that they have a big movement happening right now because people are so interested in trying to figure out how to extend their own lives.
Yes.
Of course.
Yes.
And they love their dogs. It's actually kind of naturally branched over this science called geroscience has branched over into dogs now. And so we actually do have some research that's been coming out and more papers that are coming out on aging in dogs, on things that we can be doing to help them live longer, not just longer lives, but healthier lives, which is really the goal that we have as veterinarians for them, truly, and pet parents.
So let's talk about what the Senior Dog Veterinary Society is. What does it do? What do pet parents need to know about it?
Yeah. So so if you guys go to a website, it's seniordogvets.com is the website that we have for Senior Dog Vet Society. But our goal with that society is to help advance the care of older dogs in practice today. So in vet medicine today. It's largely geared towards veterinarians, but there's a part of it that's for pet parents as well. And what we aim to do is connect those veterinarians and vet technicians and staff members that are taking additional continuing education, so educating themselves every single year on geriatric topics in senior dog medicine, take those veterinarians and connect them with pet parents like you. Yeah. Because one of the biggest problems that we found online, and you probably got this too, but I started an Instagram a few years ago, 5 years ago, so called Senior Dog Doc. And one of the things that pet parents would come and talk to me about on there was, I just want to find a vet like you that loves old dogs.
Yeah.
And for me and Molly, when we hear that, number one, it breaks our heart because we have so many colleagues and so many techs out there and so many people out there that we know of in the profession that do such a good job with them. And so the question for me was like, well, how do I connect this group of pet parents that has these old animals that they care so deeply about with these vets and vet techs and my colleagues that also love them and bring them together? So we have an online directory for pet parents. You can look up, if you're in Nashville and you type in Nashville in our online directory, you can actually look up and find vets like Dr. Molly who have taken additional continuing education in senior dog focused medicine. And you'll know that they're deeply interested in this.
Yeah. And it's a certification. So, and we've talked about this in veterinary medicine, they're boarded specialties. So this is different from that, but it is, vets and vet techs can do this too. They go through an initial educational certification. So it's 15 hours, right?
Yeah.
Of education, CE online, and then they have to keep up with a few hours every year to maintain that certification. So anyone who has it and maintains it, you as a pet parent will know they're continuing to learn more and staying on top of what is recommended.
You want them to be updated on different things that are coming out, and different techniques and stuff. And so in order to stay certified, they have to take a CE every single year to keep that up.
So let's backtrack a little bit and talk about just who are our senior dog patients, because I sometimes I feel like I offend clients sometimes when I'm talking about, senior, now that your dog is a senior. And sometimes I feel like it surprises them.
It does, right?
Yeah. It's like that's a thing that happens. And to me, it's like, oh, great. We're talking about senior things. Yeah. And clients are like, oh, no, what? My dog's a senior? And I think, you should tell me what you think, but I feel like it's because that creates some type of fear, like, oh, that means my dog's going to die soon.
Absolutely. Right. You're like, this is because, for me, senior and geriatric, those terms, what they really mean is they mean your dog's in the last phase of their life. Yeah. Right. And that's really hard to accept or to recognize, because a lot of people want to stick their head in the sand, right? Like an ostrich,
100%.
Totally. I just want to be like, no, I don't see the gray muzzle. 100%. Or I don't see the little slower walk.
Oh, I definitely have clients who are like, I literally don't want to run the blood work because I don't want to know. Don't tell me. Yeah. And I'm like, well, I can relate.
Yeah. I understand.
But I think you really do want to know.
Yeah.
Because you obviously care this much.
Yeah. And obviously, for us, we are such fans of doing things like diagnostics and trying to figure things out for them, because we see that we can make such a big impact on an older dog's life by finding things out ahead of time. And it makes for better decision making as a senior dog parent, right?
Yes.
And that's really important.
And there's so much now we can do that's preventative and prophylactic that hasn't been available, honestly, until the last 10 years. Think about so many things that have come about since you and I graduated vet school. So much has changed in just a short period of time. There was, for so many years, people, is there going to be anything checking for cancer in that blood work? And for so many years, we're like, we really don't have cancer screening for our patients. And now that has changed. There's so much that we can see ahead of time and get ahead of. Right. So if someone were to say, how old is a senior dog? What makes a dog a senior dog?
Really good question. So what we're trying to figure out when we ask, when is my dog a senior, is basically, when is the dog in front of you the equivalent to a human that's roughly about 65 years old, right? It's when are they?
No offense, humans who are 65.
And actually, I know. 65 is like the new 55, right? And et cetera. So maybe that'll change. Maybe that number will be higher, but
it's okay. We want to make it that way in dogs.
Yeah, exactly.
7 is the new 4.
Yeah, exactly. Yeah. That's what we hope to do moving forward in the future. But the question really is when are they old? That's the question. When is aging going to start impacting this dog? Yeah, is what I think about with it. And we don't have a great way of answering it, because for dogs, unlike cats, so cats are all basically the same size, roughly, right? We've got some big ones out there, but they're roughly the same size.
Other than a Maine Coon, it's a cat.
Yeah. But so it's a little bit easier to pick a certain age. So we tend to say cats are seniors when they're age 10 or above, right? Yeah. And for dogs, it's not quite as easy. However, the number that we have picked just across the board to make it a little bit easier is age 7. Yeah. But the reason why it's a little bit harder with dogs is because we have dogs that vary so greatly in their size, and that affects how quickly they age.
Right. We talked about this today in our lectures a little bit, and this is some sort of terminology nuance, but it's important. Chronological age is how many years they are, but there is something we talk about, which is biological age. And so that's their health status, what are their body systems like. And we use the example today of, if you look at 2 dogs that are both 7, so we sort of basically say, okay, we start thinking about senior things in a 7-year-old dog. But if we're talking about a Newfoundland, which is a giant breed dog who has a lot of genetic predisposition to things, they're giant, so that has a lot of implications. Their lifespan is 10 to 12 years if they're lucky. And so their biological age is a lot older than an angry, bitter 7-year-old Chihuahua who could live 10 to 12 more years. Yeah. And so that's something to sort of think about, if you have a giant breed dog, they're aging faster.
Absolutely.
On average, than a tiny dog. And so you're going to want to be thinking about these things. You're going to want a vet who is talking about these things earlier, more 6, 7 for sure. Right. Sometimes, giant breed dogs, we're talking about these things at 5, screening and different preventative things.
Absolutely.
So it's an important concept because there is such a range in breeds and sizes of dogs.
Yeah.
And they do age at different rates because of all of those biological factors.
Absolutely.
Yeah.
And there's a lot of things that go into like how a dog ages. Cause I give this example. We didn't talk about this today in the lectures, but I have this like one patient that always comes to mind for me. I'm going to call him Henry. And Henry is this golden retriever. And when he's age 6, when he walks into my exam room, he already has a white muzzle.
Yeah.
He has like mast cell tumors popping up on him. He has, other issues. Like he walks a little bit slower. He's got other issues. And when I see him walk into my exam room, I always ask the owner, I'm like, are you sure he's not like 8 or 9? And she's every single time she's like, no. And I was like, well, have you had him since he was a puppy? Yeah, I had him since he was 8 weeks old.
It's like hard to believe.
It's hard to believe. And I keep thinking in my head, Henry must have an advanced biological age, right? Like if we had a way to measure biological age.
I was just going to say, this is what we need to figure out, like those dogs. Why?
Yeah, he must have an advanced biological age. And there's several things that we know that contribute to that. So we certainly think genetics play a role, right? Just like for some people, you will have some 70-year-olds that can run marathons.
Right.
And then you have other people that their health is really, really poor, right? And maybe they're in a wheelchair or whatever the situation is. And there's a lot that goes into that. Maybe they face a lot more health issues that are growing up. Certainly things like environment play a role as well, right?
Right.
Your access to healthcare will have a role as well. So there's a lot of things that go into that. And so
there can be genetics at play that
absolutely
dogs and their people who take care of them have no control over.
They have no control over, right?
Just like some humans,
Right. But there are things that we do have control over.
Right. Which is what we like to talk about. Yeah.
That's really exciting. And so things such as, keeping them at a lean body condition score. I think you already did a podcast where you mentioned this multiple times.
Yeah.
I'm pretty sure because I think I've seen
we talked about it.
So
but I'll talk about it till the cows come home.
Yeah.
So proceed.
Yeah. And so it's really hard, but keeping them at a lean body condition score is one of the best things you can do for them throughout their life.
Yeah.
And it's not as easy as we make it sound.
No,
I have a chunky cavalier at home right now named Moggy. If you guys want to see a dog that's addicted to bread and carbohydrates, just like me, come watch my
mother
channel.
Like son.
Yeah, like mother like daughter. Come watch
daughter,
us.
That's right.
Yeah, and we have an abuela. My mom likes to come over a lot and feed her baguettes. No big deal. But my mom buys these 4-foot-long baguettes from Harris
for the
dog. Listen, she's 70 years old. I cannot control her.
I wonder if the people at Harris Teeter know that she's buying that for her dog.
It's her grand
Like
dogs.
somebody will say, hey, did you know she comes in every week and she feeds that to the dogs?
She's so hard. It's really hard. If you guys have an abuela, it's very hard to control them.
Yes.
Like, very hard. So anyways, when abuela comes over, I'm always like, oh God. But the goal that I have with Moggy is to keep her and get her at a lean body condition score because it's really going to help her life.
Yeah.
She's a cavalier. She's going to have heart disease.
She's going to have a murmur.
That extra weight is not good for her. Right. So having your dog, really getting intentional about a lean body condition score. Keeping the abuelas in check is a big part of that.
Abuelitas.
We don't talk about that. Yeah.
Yes.
Those abuelitas they're out there causing a ruckus.
Okay. So our senior dogs are our aging dogs. It's maybe a little bit different for each one, but like 7's a general number. 7's a good number.
Yeah.
If we haven't already started talking about senior things, 7's a good age.
It is.
And so when we have senior dog pets and patients and we start to address that, I think what would be good to talk about is like what do we start doing differently? One, what do pet parents do differently? A lot of this I know it's not like all of a sudden, okay, now on this day, January 1, you are a senior. So now we're going to start doing XYZ. There's a lot of preventative things that go into it. But at some point, we as vets we see our patient and it's like, okay, we're here for an annual visit. All right, now we're 7. So I know Dr. Monica and I both are going to start saying, let's talk about what this means. Let's talk about how they're doing as they age.
Right.
Here are things we want to think about as we get into this phase of our dog's life. So maybe let's talk about that in general. Like what would you recommend pet parents to start asking about their vet visits if their vet isn't as proactive about this and things that they should be, maybe doing differently for vet care or at home care once their dog's moving into that phase?
Yeah, I think that's a really great question. So certainly one of the most important things that we talk about a lot is chronic pain awareness and being aware that as dogs age, they are more prone to chronic pain. So they've got these whole category of diseases called diseases of chronic pain. And two of the most common places that we actually tend to see chronic pain in older dogs is going to be in their joints. And so it can be anything from neck pain, back pain, elbow, hips, knees. My old dog, Becca, who was an old Labrador mix, that lived to be 18, guys. I mean, it was insane. She'll be 18 years old. She was found in a cardboard box on the side of the road in Arkansas. And this dog
in Arkansas,
yeah, Arkansas. And she'll be 18 years old. But one of the big things that she had was hip dysplasia.
Yeah.
And that certainly was a big factor for her. She got older. And so she had chronic pain related to that.
Yeah.
So musculoskeletal disease is different depending on the dog, different depending on everything involved with them. And then dental disease is a big number 2, I think, that I see with old dogs.
And I mean, I'm just telling you, there's so many people listening and watching this, and they're like, no way. What do you mean dental disease pain?
Yeah.
I mean, we could talk about this the whole time, but it is. Dental pain is a real thing. And a lot of these dogs have never had a dental in their life, and their teeth are not being brushed on a regular basis. And so 7 years of that leads to a lot of disease a lot of the time.
Absolutely.
And dental disease is painful. Dental disease is painful. Even if they're eating. Yes.
Yeah.
Even
absolutely.
if they're eating.
Even if they're eating. And that's the big thing. So the reason why I think that having awareness of diseases of chronic pain in older dogs is so important is that the signs are very subtle.
Yes.
Okay, so
tell us about them.
They're very subtle signs. They're very, very subtle behavioral signs that will change in these older dogs that oftentimes we just attribute to age.
Yeah.
And that can delay them getting treatment, such as delay them from having a dental because you don't notice it, or delay them from getting medications to help them with their arthritis or whatever it is that's developing for them. And so one of the big things I always talk about is if you see a change in your older dog, whether it be really small, like, maybe he takes a second now and looks at a bowl of dog food before he actually goes and eats from it.
Mm-hmm.
Really small changes are really the only way that they have to communicate, animals have to communicate to us that something might be hurting or something might be off.
Yeah.
And so never, ever assume that a small behavioral change in an older dog is just due to age, because you might miss out on an opportunity to help your dog get more comfortable, to help treat something that would give them, better quality of life and happier aging.
Yeah. And both of those common sources of pain, so musculoskeletal disease and dental disease, they do so much better if we treat them early on. There's things we can definitely do to prevent them, but in a lot of dogs, it's inevitable. Yeah. And so the earlier, like you said, we can do something about it. It's a lot harder to get on top of those things once they've progressed and are more in stage. It's like, I mean, I could talk about dental disease all day, but, in dogs, aging dogs with dental disease, I find a lot of people, I don't know if I think sometimes it's like, oh, we're just going to sort of ignore that because they think, oh, we shouldn't do the dental because they're old, or it's okay, I don't know how long they're going to live, or this is just like something that old dogs do, like you said. But it's really not. And so many times I end up taking all of a dog's teeth out because now they are 12 and their pain is more obvious. It's been there a long time, but now they maybe aren't eating, or they are bleeding from their mouth, or they have an abscess. And so we have no choice. And then I hate those situations, because so many times owners are like flabbergasted. And they're like, how did this happen?
Right. There's so much guilt after that too.
Yeah.
Like, they're like, I've been putting it off. I didn't know. You're not going to know.
Yeah.
Which is why we do have to do those dentals, even if you're not seeing the signs of it.
Yeah.
And because the teeth can look perfectly beautiful and white and pearly on the top with very mild tartar. And then we get them under anesthesia and we take these dental x-rays and we see they've got an abscess root underneath here.
Yeah.
And they never would have told you. We wouldn't have even found it on our physical exam of them.
Yeah.
Like, that's the big thing. And what happens, and this is like one of the things where it like really clicked for me, like as a veterinarian, but I've had these old dogs, I have these beautiful teeth on the top. They look beautiful and white and glossy. You do the dental, you find a rotten root. And as you kind of like poke around there, their heart rate goes up.
Yeah.
Because it hurts them. And so, then we do a local block, and then we make sure that doesn't hurt them anymore. But, they have that reaction and they have no way to tell you.
No.
They can't talk.
Yeah. And it takes so much for a dog or a cat, more a dog, to stop eating. so much.
Yeah.
And so many people think about, well, they're still eating, like they're probably fine, but that is like the last thing that we should be. But like you said, subtle things like, do they eat a different way? Do they hesitate? Do they spit some of their food out? Are they, this is a common one, are they specifically eating one part of their food, like maybe the soft bits in their food, but they used to always eat all of their food.
They eat around it. The other thing too is like, people are like, well, I hear them crunching on their dog food, so I know that they're eating just fine. Guess what they do, guys? They will eat on the two good teeth in their mouth on the one side and just crunch on those all the time. So you're like, they're crunching, like they're doing great. They're just eating on this one side with these two good teeth that feel okay.
Yeah. And then maybe let's talk about like joint musculoskeletal signs of pain too.
Yeah.
Like, because some of those are very subtle. I think it's good for people to hear those.
Yeah, absolutely. So obviously limping is a sign of something hurting. Even if they limp and they're wagging their tail.
I think this is a novel concept though for some people.
Yeah, no, I think you're right.
I think there's some misunderstanding about what limping means.
Yeah.
Limping means pain.
Means pain.
So many times, I know you do too. We hear, well, yes, they're limping, but they're not painful.
Yes.
And pet owners don't say that because they don't care. They truly think that they're just limping. I think they just haven't really thought through what that means.
Right.
But yes, any degree of limping indicates pain because dogs want to use their legs.
Yeah.
And so if it didn't hurt, they would.
Right.
But yeah, limping is pain.
Limping means pain. Exactly.
Yeah.
Fantastic.
Even subtle.
Yeah. And the other signs that you can notice certainly is they are slower on their walks. Like they're not able to keep up with you as much. And that could be a sign of other things like heart disease, et cetera, too. So if
or
you
they
notice
just
them,
stop, sit down.
They don't want to go on their walks.
We're going home now.
Yeah. They're like, let's turn around now. Mm-hmm. That could be a sign as well. So there's a lot of people notice that they're slow to warm up in the morning.
Yeah.
They seem stiffer. That's a really big one. If you notice them just being not as smooth when they go from laying down to standing up, like you're like, it just looks like it's like a struggle for them to get up. Something's hurt.
Or getting like down from the couch. Like if all of a sudden they have to like do their body a weird way to get off the couch, that's usually some type of compensation for some kind of pain or discomfort.
Absolutely.
Aggression, like behavior changes can be signs of pain.
Yeah, it can be big signs of pain. Stiffness. I think that those are some really common ones that we'll see with things like, joint pain.
Yeah.
And just to go back real quick to the whole limping being a sign of pain, I will tell you guys this, and this is not chronic pain. This is a sign of acute or sudden pain. But the very first time, so when the very first time I started working in an animal hospital, I started off as a vet assistant. And one of the things that always shocked me was there was a Labrador retriever that was hit by a car, and it broke the poor guy's like little back leg, and he came into the clinic. The owner was panicking, brought him into the clinic, and this dog was actually stable, which is not common, which is very positive for a hit by car because that's not often the outcome that we have with those. But he was stable. He came in and the dog walked into the exam room, wagging his tail, holding up his back leg that was broken.
That's such a lab.
It's such a Labrador. And so, and the question is like, was that dog not in pain?
Right. Yeah.
That dog was absolutely in pain.
That's a great example.
He was just also, he can't not dog. Like, he can't not dog. He's going to be happy.
He can't not lab.
Lab and like pant. He hurts and he's panting partially because of that too. But, he got his leg fixed and he did fantastic after that, which.
Yeah, our pets are really good at hiding pain because that's what they're innately wired to do to a certain degree.
Absolutely.
Or they're just doofy labs and they're
doofy. Yeah. They can't not be the
with a
doofus,
broken
right?
leg. Yeah.
So that dog hurt, and that's just a really great example of how easy it is for them. Not easy, but how well they hide.
Yeah. Yeah. So our senior dogs, pain is a big part of what we manage in them. And it's a big part of what we do for them when they come to visit the vet, right? So today, a lot of what we talked about was care programs and vet clinics. How can clinics be more senior dog friendly? How can we help their visits go more smoothly and be more helpful? And pain has a lot to do with that because we talk about sort of how to tailor their visits for that. I'd love for you to talk a little bit about kind of what we spoke through with vets today, like how to alter what a vet visit looks like for a senior dog.
Yeah.
How we handle them.
Yeah. So because older dogs certainly are dealing with different changes in their body. And we talk about different changes such as they get older, they start, for example, losing their senses, right? So almost every old dog will have age-related hearing loss at some point in their life, some sooner than others, but they will develop that. A lot of them are going to start developing changes with their vision where they can't quite see as well. So the environment around them is different. So you combine those changes with things such as diseases of chronic pain that we talk about, and your dog's ability to kind of get around anywhere, but even in an animal hospital can be challenging for them. So there are things that certainly we recommend, such as yoga mats, having out for all these old dogs. We like the idea of having like a room at an animal hospital that's specific for older pets to get an easy access for them to get in and out of if they're having issues of mobility. We like the idea of doing a lot of the things just for the vets and techs, which we talk about this today. We like them to do a lot of the things in the room with the owner, with the old dog. So those are some things that we certainly do and talk about for them.
Yeah. And I know this is a question I get a lot. So people with older dogs, everybody wants to know, how do I help them? How do I keep them from developing these diseases? How do we help them age better? And so obviously we talk a lot about like what we do once they're seniors, but I think what we do before they become seniors really sets them up for success or failure to a certain degree. Because like we said, some things we can't control. Right. Genetics are at play. I do think it's important for pet parents to understand, if they have a purebred dog, like what that breed, what happens to those, what are they predisposed to? What am I looking at? Like with a Cavaliers are predisposed to heart disease. So awareness about that is important. And we as vets, it's something we should be talking about with our clients, but pet owners can be proactive about that. So, I get questions a lot about how do I keep my dog healthier longer? So what would you say are, like, if you had to pick, I don't know, three things, I'm going to make you pick 3 things.
Only 3.
Okay. 4.
Okay, good.
4 things. You can do 5. What are
things.
the 5 most
7 things.
No, 5. You can 5. Okay. We haggled already. 5. So what are the 5 things that you would say are the most important things for a pet parent to do before their dog becomes a senior to help them age better?
Okay. So 7 things.
No, 5.
Okay. Okay. So
5 things.
All right. So obviously the very top one for us is going to be keeping them at a lean body condition score.
Yes.
And the way that I want you guys to do this is I want you to actually ask your veterinarian what the dog's ideal body weight is. Okay. Because a lot of times, to be honest, when we tell people that their dogs are a little bit overweight, not everybody reacts kindly, guys. Believe it or not.
And I am. Are you a weight? Talk about weight vet, because I am like, I feel like every vet clinic there's the one doctor who like harps on the weight, and I am definitely that doctor.
That it may not come up because there's so many other things going on or whatever, but go in and ask them what your dog's ideal body weight is.
Yes,
and what it usually is. Like, I'll give an example of Jose. I had this husky, and who I lost recently, and I don't want to talk more about it because I'll start crying.
Yep. Nope, me too.
His ideal body weight was between 58 and 60 pounds.
I like a range.
I like a range too, because you can have a little bit. I need a range for myself.
We like a range, right? Okay?
Like a range, right? There's a little bit of forgiveness in that. But his ideal body weight was between 58 to 60 pounds. So we always knew that we needed to aim to keep him there. And when he would be creeping above that, 61, 62, 63, things were good. Probably Abuela was at the house for
Abuelita.
Abuelita's there with her baguettes, her 4-foot-long baguettes. And we had to try to tame her.
You got to give her a call.
Tell her to go back.
Yes. Don't come back. Bye.
So my one thing was going to be ideal body weight.
Okay.
Do you want to give one of yours?
Nope. I want you to keep going.
I'm going to keep going. So
ideal body weight.
Ideal body weight.
I love it. That's what I would say.
Okay, great. Obviously, and this is tied into animals living longer and having healthier lives, but vaccines.
Yep.
I know that there's so much.
We're not scared here.
We're not scared.
Yeah,
okay, good.
Okay.
But vaccines, and every time that you discuss vaccines for your dog, it should be specific to the dog in front of you.
Yes.
Okay. So there's not just this like every vaccine for every dog. That is not it.
Yeah.
But vaccines do help keep them safe.
Yeah.
And they are one of the reasons why I think dogs live longer. Okay.
Yeah. And there are responsible ways to vaccinate our patients, and we're always figuring out. I mean, veterinarians want to know what's the safest way I can vaccinate a pet just as much as I want to, which is why we transition from every year, a lot of vaccines to every 3 years. We've done that with the vaccines that we can do that with. But yeah, lepto, I'll get on a soapbox, but the leptospirosis vaccine, I just feel like even in the context of senior dogs is so important because so many, I mean, most of my, I don't know about you, I don't know how much lepto you see, but most of my lepto cases have been little white, crusty, middle age to senior dogs.
Just so funny because you used to think it was just a rural dog disease.
Yes.
But it's not anymore.
No.
It's like a city dog disease.
Yes. Some of them were when I worked in right over there in downtown Nashville, high-rise apartment dogs.
Right.
A dachshund I diagnosed with lepto in a high-rise apartment in downtown Nashville. But yeah, and it's these older dogs and when these older dogs, if they do, God forbid, contract a terrible disease like that, they're already more frail. And so they're so much more susceptible to the fatal effects of those diseases.
Yeah, absolutely.
All right, we're not going to get on the vaccine soapbox, but I agree with you. Okay.
I've got 7 things I need to talk about here, Molly. So
you
the
have
next thing is going to be
3 more. I can't count.
Certainly.
Okay. Lean body condition
score.
Vaccinate appropriately.
Okay, I have to go through the basics though. So of course, prevention, guys, is really important. I'm not going to spend a lot of time on that.
Okay, vaccines and prevention can go together.
Okay, those are together.
So vaccines and preventatives like heartworm, flea tick. Yep.
Okay, great. So vaccines
intestinal
and
parasites. Yep.
Good.
Those can count. That's 2. All right.
Okay. All right.
So you got 3 more.
I got more.
Mm-hmm.
So the next thing, and this is important. So what the science actually shows is that dogs that are neutered do live longer. Okay. And that is across animals. I know there's a lot of people out there that are, we
just talked about this.
We did. Okay. You guys did.
I did a whole episode on this.
Now the timing.
Yes.
Matters.
So she means spayed or neutered eventually.
Yeah.
At some point.
Instead of intact.
In their younger life. Yeah.
Versus pets that were not spayed or neutered. Those in the data do tend to live longer, and that's important to recognize as well.
Yeah.
Okay. So I will always
and
do
some
that
of
with my
what
pets.
goes into that is like environment, like dogs who are intact are more likely to wander and they're more likely to be like hit by a car. And so there's some accidental death that plays into that, but probably not enough to say, oh, that's the only reason.
Right.
But yes, that is a thing. The research shows that dogs who are not intact, so have been spayed or neutered, do live longer. Okay, that's number 3.
All right. And so number 4 for me is going to be dogs that exercise. Throughout their lives. Like movement is so important. It is so important to keep them active throughout their life. And I'm not talking about like, we haven't done anything in the winter, so I'm going to bring them to the beach to run for 3 hours and get heat stroke and right? Like we're not talking about that. We're talking about consistent activity throughout their life that is
you can put physical and mental stimulation in the same category. You're welcome.
I don't know if that's a gift or not, Molly. But fine. Okay, yeah, let's do it together. So physical and mental enrichment would be great. So, but keeping them active throughout their life. And that's one of the things that I even though we're talking about what to do when they're younger, I love to keep older dogs active. Like, I love movement within reason for their health.
Yeah.
And we'll talk about kind of what that means because that's different for an old dogs and we can give examples of that. But certainly.
But if they've had plenty of regular exercise before they become old dogs. They have great muscle mass going into their senior years. You will put your dog way ahead of the game before they become a senior and are more likely to develop other comorbidities.
Right.
They've been active. They've got great muscle mass. They're lean, muscly.
Oh, yeah.
I mean, this is logic.
It's logic. And so
it's the same for humans.
It is logic. And we have more evidence of that in the human side. So like for humans, we know that exercise helps us have healthier and longer lives, right? We don't have as much data on that in animals just because our rehab folks are still catching up with producing those research. But I think it's very natural and very reasonable to make that.
And it certainly doesn't harm them.
No.
To be
as long as you're doing it within reason within reason and you're smart about it, it's going to be great for your dog.
All right. Exercise and mental stimulation. Let's talk about mental stimulation.
Mental enrichment. Yeah. I love that.
Enrichment.
Mental enrichment.
Do we call it stimulation?
I think you can call that
using a weird word?
No, I don't think.
Sorry. Enrichment. Mental enrichment.
Mental enriching of their brains.
Yes. And so, which we can do in a lot of ways, right?
Yeah.
Make your dog think about something.
Yeah. training. They love training. And it also gets like bonding time with them. But training is so great to do with them.
Give them a job.
Yeah. So
because a lot of dogs were bred to have a job.
Oh, absolutely.
And then they just sit in your house all day. That's not a job.
They eat baguettes.
I mean, I would love that job.
Yeah.
I would love the job of being a couch potato.
Yeah.
But that's not a job for them.
We would thrive at that.
Yeah.
That was, we would thrive.
But they need a job and they don't care what that job is. One of a trainer here locally who we had on the podcast who I love, Kevin, I love what he does. They'll put, they get these big plastic empty coffee container things. And I can't think of the brand, but all these plastic like drink containers, and they'll put them in a big like water trough, and then they'll fill them with it. And then they'll put kibble, like poured kibble down in there. And so dogs have to like dive in there and dig through and find the kibble.
I love that.
And like, it's so simple, but like, that's a job. Like that dog doesn't know that that's a pointless job, but like that's a goal. It's a job.
Oh, absolutely. That's fantastic. And I think it varies depending on like the dog that you have too. Like I had this little old Chinese crested named Orwell who was obsessed with his like tennis ball and his squeaky. His mouth was like this big.
Yeah.
And that dog, so we bought little tennis balls that were this big. We're like, look, he's got a little mouth. He likes tennis balls. We're going to buy the tennis balls that are his size. He did not want those tennis balls. He wanted a real big boy tennis ball. So he would use his little mouth and he'd run around this tennis ball, this thing. Anyways, for him, mental enrichment for him was definitely playing with his owner and chasing balls.
Yeah.
That was what he loved to do.
Yeah.
And certainly we had food puzzles and other things that he would do as well. But he loved a good new squeaky toy. He loved a good new tennis ball. Like that was very enriching for him. So certainly mental enrichment is good. And I always, depending on the dog, but, ideally I think you're doing 30 to 60 minutes of that with your dog if you can a day.
Yeah.
Right. If you can fit it in. And you can do it in cool ways too. Food.
Yes.
Puzzles. You can do training with them. I think that dogs really respond to that. They love that.
Yeah. Snuffle mats. I mean, that's not something.
Yeah.
Even like anything, you want to give your dogs treats and things. And so just making that simple act more of a challenge.
Yeah.
Just makes them think about
Go
something.
find it. We love go find it for those really tasty treats. I make them go sit by the door and then I go hide their treats in different places. And I have to go around the house and sniff for it.
Yeah. Even like the Pupsicle. Shameless plug for my favorite enrichment
I do love
toys.
that though.
Yeah. The Wolf Popsicle.
Yeah.
It's a treat in this like rubber toy thing, and they have to like work to get it out.
Yeah.
And so you're crossing two, or you're checking two boxes. You're giving them a treat.
Yeah.
That makes us feel good. We want to do that, but then we're also giving them a job, so they have to use their brain.
Yeah.
All right, that's 4 things. I'll let you put those in the same category.
You did. Okay,
so
I do appreciate that. I take it back. I do appreciate letting me do that. So what have I done?
So we did weight. We did vaccines and preventatives. We did spay and neuter.
Okay.
And we just did physical exercise and mental enrichment.
Okay. Okay. So the next thing that I think is really important to help extend a life are going to be keeping up with your dental cleanings.
Okay.
Okay. So I'm going to add that one.
I'm going to let you do 7 because I'm like, wait, but we have to say these other things.
What are the other things?
Well, like diagnostics.
Oh, yeah. Okay.
I was going to whisper to you.
Monica, diagnostics.
Diagnostics.
I was also going to say diet, but I don't want.
Oh, yeah. No, so okay, we're going to do 7 things.
We're doing 7.
Okay, so number 5.
We decided on 7.
5 is dental care. Yes.
You keeping up with that. Like, honestly, like,
yes.
We know that bacteria in their mouth that they swallow and is being released into their bloodstream does travel and go onto organs, and it can help it can damage those organs, right? And allow them to age faster. And so keeping up with dental cleanings under anesthesia, right, is going to be really important for them. And so I think that is honestly something that when I see someone taking really good care of their dog, they're getting those dental cleanings done.
Dental cleanings and, to the best of their ability, at-home dental care.
Yeah.
So yes, brushing teeth at home should be happening.
Yeah.
And I know it's
hard.
I know it's hard. Like, we recognize that. I think it's important we keep talking about it, because I think the earlier you start brushing teeth, the better success you'll have, because puppies are more likely to be desensitized to whatever discomfort they find in that and get used to it. We love for people to adopt middle-aged to senior dogs. And so you may adopt a dog who's never seen a toothbrush in their life. And there's ways to get them used to that. But then there's other things. So brushing, there are dental rinses, dental wipes, dental chews.
Yeah.
doing something is better than nothing.
Yeah.
Brushing at home is the best.
Yeah.
But whether you're brushing or not, regular dentals under anesthesia with your vet. And I am glad for the switch from, we've for a long time thought about dentals as reactionary. Like, oh, that dog has terrible disease in their mouth. Now we got to do a dental. And I think that mind shift to, we're going to start doing dentals earlier to prevent that disease from developing. And because like you said, it can wreak havoc on so many things. Kidneys, liver, heart, we know all that bacteria in the mouth is hard on them.
Yeah.
Okay. Yes. Obviously, I agree. Dental care.
Okay.
All right. That's 5. So number 6.
Diagnostics.
Diagnostics.
All right. So things such as checking in on things like blood work are really important. Of course, those fecal checks, we do want them to not have parasites. So those are very important to maintaining a really healthy dog and setting them up to age well.
Yeah. How, I know you're doing relief right now, but when you were in all the time GP, how early did y'all start offering like wellness blood work, like at their first annual visit?
Yeah, we did. Because remember, I mean, the really important thing, and we talk about this in our visits, is that dogs age faster than us.
Yeah.
So even though it seems like we just did it last year, that is equivalent to them aging several years, right? For them, if not more, for many of those dogs. And so we don't go, at least I don't go, that long without blood work for myself. Molly, don't you dare.
Don't ask me about that.
Don't you dare. Anyways, for people that
actually have a primary care provider.
Good God. All right, we're going to need to get a human doctor on
my
here
OBGYN is my primary care.
Oh my God.
She's all like, now that you're not having children, you're going to have to go find a real doctor.
She's like, I'm sorry to put this to you.
She may or may not have treated a UTI for me recently. So she's like, God. Molly, you have to get a doctor. I'm like, I know. You're like, no. Sorry. But yes, don't be like me. Don't take your dog to the doctor like I go to the doctor. You should be doing these things early and often.
Yes. Mm-hmm. Yeah. And so we want to be doing things like that.
Yeah, we offer wellness blood work at dog and cat first year visit, like a year after they finished all their puppy vaccines. And a lot of times people are like, oh, well, why would I need to do blood work? They're only a year and a half, 2 years old. And I love when we have the ability to track what those things look like starting from a young age, because when we've done blood work every year, or even every other year, we can pick up on subtle changes
a lot easier
and trends in their lab work that tip us off, so that, for example, I always think about like kidney disease. In a lot of patients, we can see kidney disease coming. Right. And so then we have a better plan and we can tailor things to better manage that once it becomes full blown kidney disease. So yes, I agree. Diagnostics.
Great.
And then why don't no, we'll finish and then I'll ask you about this. Number 7.
I was so glad we got here because I was pushing for this.
Okay. You're welcome.
Thank you for letting me do this. Mm-hmm. Diet, I think.
Yes.
So I think choosing an appropriate diet for your dog is really important, obviously, and it varies greatly by the dog and by the breed, but I do think nutrition really does matter. I think that it does. And so I think talking to your vet about what you're looking for, allowing us to help you, give you some suggestions on different diets is really, really important. And
yes. And I think another thing, this is a good place to talk about when it comes to nutrition. I kind of giggle because there's a lot of these like crusty old senior dogs we see that's kind of classic. We talked about it today, like an old Chihuahua and their owner's like, or no, it wasn't us. Julia Miller talked about this today. Old, like crusty dog. And their owner's like, yeah, they've been eating like turkey lunch meat and cheese sticks for 4 years and they're thriving. And like, that happens. We hear that. And people talk about, my parents fed my dog table scraps forever and they were fine.
You're lucky.
You're lucky. But I always take these conversation opportunities to say, with a client, I love that you care so much that you want to make this food at home.
Yeah.
Like, wow, I do not.
I do love that.
I couldn't. I don't have the capacity to cook for Cooper too. I'm already cooking for a lot of people. So I try to recognize like, wow, that's awesome that you want to cook for your dog. And I'm sure they are doing okay on this, chicken and fried rice mix from the freezer every day. But nutritional deficiencies are real and they happen, but it takes a long time sometimes for that to actually show up and cause changes and clinical signs. And it's like we've talked about all these other things. Then that becomes a reactionary thing. And like the dental disease, it's hard to get on top of that if it's gone on for so long that it's out of control.
Right.
Which is why it is important. And it's why your vet probably asks you every time you're there for a visit, what are you feeding?
What are you feeding them? Yeah.
What are you feeding them? And people are like, well, the same as last year. I'm like, okay, great. We just want to make sure.
Yeah, I just want to make sure. Yeah. And I don't, obviously we're not going to dive into this too much, but like it's really hard right now for pet parents because they're being shamed everywhere they go. Yes. They're being shamed, right?
We did an episode on this.
Okay, great. So I'm not going to dive into it.
We hit all the hot topics first.
All right. Well, we'll progress. We'll move on. But
yes, we're all doing the best we can.
Yeah.
And that looks different for different people and different dogs. But the take home with nutrition is you want them to be on an appropriate diet, appropriate for their age, appropriate for their, lifestyle, their activity level, and the appropriate amount for what their weight is, what we want their weight to be.
I agree.
Okay, that's a great list of 7 things.
I know. I am really proud of our list too.
Okay, when we were talking about diagnostics, I pinged myself. I don't want to forget to talk about this. And we could talk for 12 hours about this, so we're going to have to wrap up in a minute. But I do think, what do you think about, this is more of an oncology topic, but what do we think about talking about cancer screening?
I think it's really interesting, right? Because there's so many different options that are out there right now. So I am excited about it.
Yeah.
Because I think that it's really cool. I have not decided on one test yet. I'm still waiting to continue to see.
There aren't a ton of options.
Yeah. And so I'm still kind of waiting to see how I guide people on that. Yeah. But I do think it's really reasonable for people to pursue, especially if they've got an older dog, that maybe is more prone or predisposed to a certain type of cancer.
Yeah. So if pet parents out there don't know about it, we do have a couple of cancer screening tests for our dog patients right now. Nu-Q is one that's a blood test. We actually even have it in our practice now in-house, so we can run it in just a few minutes. There's a urine test that I know about called Oncotect, and it's very similar in how it sort of screens things. But I think it's important people to know these screening tests are not definitive. They're not, it's not like a black and white test, like your dog has cancer or your dog doesn't have cancer. No, but it's just another tool we have. And it is something we talked about today, not about the cancer screening test specifically, but anytime we have senior patients who are going to have big procedures done, so maybe they are going to have a dental or they've got a ACL tear and they need a TPLO, like a big procedure. It is something we can now sort of think about, and there's different testing we can do to look for signs of cancers before we get into these other involved things. So this is on the horizon, and it's exciting.
It is exciting,
but we're proceeding with caution.
Yeah. I mean, I think we're like, this is amazing. This is where we should be going, is having these kind of tests developing, and we'll better be able to figure out how to utilize them more efficiently and as best as possible as we learn more about it and have more cases with it too.
And we don't want to overinterpret them. Did I tell you I ran a Nu-Q on Cooper?
No.
Yes, I regret doing that.
You do? Oh, okay.
Well, only because, so I ran one and it was like a titch high.
Okay. So now you're like,
so there's like a green, yellow, and red range. So the lowest range is unlikely to have these two types of cancers. Yellow is the middle, somewhat increased risk, but not probably. And he was just at the bottom of the middle, increased the moderate.
Right.
But I panicked.
Yeah.
I did exactly what I don't want my clients to do. I was like,
you're like, no.
So I had a full body ultrasound on him the next day.
Yeah. You're like, you're coming.
Everything looks fine. Cooper's fine. I need to rerun it. It'll probably be normal next time. But I'm excited about them, but that's my hesitation about them right now.
Right.
Is over interpretation or unnecessary stress and panic.
I agree. And that's, and I'm going to share this story with your audience because I think it's just so important. But I mentioned previously that I had this husky who I lost, guys. I lost him. It was
10 days ago.
10 days ago.
Yeah. So this is raw.
So I've been crying a lot. So just if I'm not crying, it's not because I'm not sad. It's just because I've been crying nonstop about it. So I had a really beautiful husky. His name, Husky Mix. We adopted him from a shelter in Charleston when I was a 4th year vet student. And so he's been with us. We had him for 11 and a half years. He was almost 12 years old. I decided to do a dental on him a little while ago. And one of the things that's really interesting are things that I actually offer, and you can ask your vets about it, because this is not standard that we do this, but traditionally for any senior dog that's about to have a dental, and senior dogs do still need dentals, very much so. Okay. Because we want to make sure that they have the best golden years, and making sure that they have a mouth that does not have pain is part of that. So senior dogs need dentals. And so commonly what I end up doing is for older dogs that are age 10 or above, we always do pre-op blood work. That is a standard that we have for them, because we want to make sure that we've got, a check on that. We do a physical exam on them, obviously make sure we don't find anything new or different on them. But one thing that I offer to pet parents that have dogs age 10 or above is I offer also a set of chest x-rays on them, especially if they're larger breed dogs. And it's a thing that I do really commonly with them, because dentals are really serious financial investments. And so they're sometimes on blood work, we don't always pick up on things, which is why Molly's bringing up things like, possible cancer screening tests. We don't have a checkbox on blood work that says, yes, this dog has cancer, or no, it does not. And that's one of the things I think that frustrates people the most. They're like, what do you mean it didn't show up on blood work? It does not always show up on blood work. In fact, frequently it does not. So sometimes we'll do imaging, such as x-rays, to look for cancer, just to see, okay, like, blood work looks beautiful, but like, what if we just took a picture of this dog's chest or their abdomen or whatever it is you want, and just to make sure we don't see anything there. So I commonly offer that to pets. Well, I had my own husky who was so healthy, like dad showed no signs of slowing down at all, that I needed to get his teeth cleaned because I hadn't done it in about 2 to 3 years, and he was definitely due for it. And so brought him in to go see one of my good friends to have him do the dental. I was there all day with them. The dental was so routine, beautiful dental, no like qualms with anesthesia. They did a fantastic job, the people that had him, that did the dental. And then he just seemed to have a slower recovery than normal. So about 2 days after his dental, he started having this diarrhea, and it didn't respond with a normal treatment that I give him. So I put him on an intestinal antibiotic, and he wasn't eating quite as much. And I was like, God, this diarrhea is really taking a lot out of him. Then 4 days after the dental, or 5 days after, he developed a cough. And I was like, okay, you're a little bit tired still. Your appetite isn't quite right, back to normal. And now you've got this wet cough. So I took him in, I did a set of x-rays on him, some chest x-rays, and I thought I was going to find pneumonia, because sometimes post-operatively they can have that. But what I ended up finding was cancer in his chest. And it broke my heart. And unfortunately, it was a very aggressive cancer. And it took him within 9 days, unfortunately, of us finding it on his x-rays. And we went to oncologist, which is a cancer specialist veterinarian, and they were fantastic. We started him on steroids right away, as well as some chemotherapy. And the cancer was so aggressive that despite us starting him on that, it kept growing. And we just knew after, those days that we didn't want to keep trying new treatments. We wanted to give him a good death. That was what I really wanted for him, was to we gave him a really good life, and we wanted to make sure he had a really good death, which was a peaceful death, is what we did. So
and people may not realize that the one reason we kind of maybe start imaging wise with chest x-rays is because a lot of cancers will metastasize to the chest. So even if we have cancer sometimes in other places, you can see signs of it with a chest x-ray. So sometimes just like a quick check. Yeah. Like, let's make sure our chest looks okay. We can find obviously other things, primary cancers in that. But it's just like a kind of hot spot.
It's a hot spot. Cancer. You don't always find it in the chest. So sometimes you might be like, I'd rather take abdominal x-rays or both of those or something like that. And that's something to talk to your vet about what you want to do and whatnot. But chest x is usually the standard that we go to because of what Molly just said. So.
Yeah. Or if we see a patient who we suspect might have cancer somewhere else, a lot of times we're thinking about, well, let's take a chest x-ray, because if we see signs of metastatic cancer there, then the other location we're concerned about cancer is probably related to that.
And that's one of the things kind of worth mentioning is that, older dogs, one of my good friends, Dr. Lisa Littman, she always has a saying, which I love. She always says, anything above age 10 that you get with your senior dog is bonus.
I love the bonus phrase. Yeah.
And I love that idea, because it just, we had a question about anticipatory grief, which is very common. We can talk about that in just a second. But if you are thinking and treating your old dog like, any time's going to be the last day, and you're cherishing them every single day, and you're giving them everything that you can every day, which looks different on different days and different seasons of our life. But if you are doing that, you're not going to have regrets when it comes, or as many regrets. I feel like guilt always comes when you lose a pet. There's always this element of guilt, no matter how perfect of a life you gave them or how much great care you gave them. But you're going to feel a lot better about being like, I gave him all that I could when I had him. And so I think that thinking about that as anything above age 10 as bonus is really is really helpful to encourage.
And our senior pets, just like they bring us, like our senior pets that we have and our patients as well. They just are, there's so much joy associated with our senior pets and our senior patients. They just like, I don't know. There's just something about an old dog because they just, they're
a wise dog.
Yes. And like, yes, they just like, they're an old soul too. And they just have like lived the lives and they have seen things and they've just, I don't know. There's just something like almost spiritual about them because they just are really special. And I put up a question sticker, which we're going to answer a couple questions, but someone answered with not a question, but just said we should all adopt old dogs.
100%.
And it's my favorite thing to have clients. And that's what they do is they go to rescues and shelters and they find little crusty old dogs and they adopt them and bring them home for those golden years of their life. And I can just tell you that like they're
so rich. They're so full of life and love. Like they're so great.
Yes. And so many of them, especially in like rescue situations, they really have like been through so much.
Yeah.
And they're still just like the sweetest little dogs who are just happy to be in a loving home.
Yeah.
So
we met a senior dog today actually at our lectures.
Sassy. Yes.
She was a little tiny, I don't know, she's like a 7-pound Maltese creature with Lucky.
Music City.
Thank you.
Animal Rescue.
Music City Animal Rescue.
Yes. Music City Animal Rescue.
And if that's wrong, we will fix that,
we'll fix it. But I think that's right. Music City Animal Rescue, which is local.
Yeah.
They were here at the conference. They had some adoptable dogs. So they're a foster-based rescue. But I was talking with a founder today, and she did say they really try to focus on pulling senior dogs from shelter situations who aren't typically adopted very quickly. Yeah. And they get them into great foster homes and find them the right homes because, you know, they have more special needs than the average young adoptable dog.
Well, I tell you, I
love it.
I met my soul
Monica
dog.
Almost took her home.
I almost took her home. So the technicality.
Sassy almost went to the best senior home ever.
Sassy came to us with a floral dress and a pink cowboy hat. If you can imagine.
Well, I'm going to post pictures, but yes.
And so
Sassy came to our lecture
immediately. She showed up at our lecture. So we're about to go live with like over 100 veterinarians in the room
Monica was like,
on this lecture that we haven't done before. And we're like, all right, here goes. And then this old crusty dog comes into the room with a pink cowboy hat on.
There she came.
Like, we heard you two would like this. And we're like, like this. Like, I'm about to pack this thing in my suitcase and take it home with me.
Lecture's canceled. Like, we're just hanging out with Sassy now.
Yeah, basically.
So Monica was going to take her home, but she's not. So Sassy is still
Sassy's available. And
we're gonna put a picture of Sassy in this with her cowboy hat on. We have a picture of us with
crusty.
Sassy.
I mean, she's perfect. Sassy. And so, but anyways, you know.
She wasn't very sassy though.
She wasn't today. She was very sweet. But apparently if you have another dog that comes up to her, she's going to be like, listen, this is my lap.
Yes.
Back off.
Yes.
Kind of thing. But really, I think one of the interesting things is, you know, I met my soul dog when I adopted him as a senior dog. So Frodo was my soul. I was lucky enough. I'm lucky enough to have had 2 soul animals.
Yeah.
Like I can't even believe it. But I adopted this old, decrepit looking, this 12-year-old named Orwell. Well, so his name was Snowflake when I got him.
So funny to me now.
We named him Orwell, and he was this white looking. I wanted a really cute old Maltese. Yeah, but I kept applying for these Malteses online, and they wouldn't approve me.
What?
I don't know, because I worked. So I had a job, as a vet.
How dare you work?
So I kept applying, and then like sometimes it was people had adopted them before him and found him, and I kept going back. And whenever I'd enter a Maltese, there was this weird looking creature on there that was this like long legged, small head, no neck, twisted like this, like old hunchback dog. And he kind of looked like a Maltese because he was white, and his legs were too long for his body, like spider legs. And I was like, ugh. I don't know about that thing. Someone's going to love that. But I kept going back online for 4 months applying and not getting anything. And I was like, I'm desperate. I'll apply for the weird spider Maltese.
There he was.
So I applied for him. I was desperate. I went and I met him. I was like, fine. I'm like literally dying to have a small dog in my life. I'll take this spider Maltese home with me. So I took him home. Almost returned him 2 months.
I didn't know this part.
Because he kept us awake all night. And we were
what was he doing? Just like whining?
He was crying all night. And we were trying not to let him sleep in our bed because as you know, as a vet, you have to get good sleep.
Yes.
You got surgery the next day. You can't have been up all night with your crusty old dog.
So did you finally just let him in the bed?
Finally let him in the bed, sleep on the covers, and he slept. So after 2 months, and
I'm going to sleep like a baby now.
Yeah, he like kicked us with his spider legs, and he was like, "Oh, this is great." And then we were like, "Okie dokie." So
wait, I told you that's how wait, okay. I have this awesome crusty patient, Thor, who, if you follow me on social media, I post Thor all the time. I've called Monica about Thor multiple times. Like,
I get FaceTime.
What the heck do I do with Thor now? His mom's probably listening to this. Hi, Dawn. But she's like, he wouldn't sleep. He wouldn't sleep. She's like, Dr. Molly, he will not sleep. I don't know what to do. He's like waking her up all hours of the night. And so she's like, we had to kick him out of our bed like years ago. Like, he cannot sleep in our bed. And so finally, I mean, like, we did everything. You gave me a long list. We did everything. None of it worked. So finally she called me. She's like, we let him get back in the bed and he's fine now.
And now he's sleeping through the night.
Okay,
I love that.
That's all he wanted.
That's awesome. Oh, these old spoiled dogs.
He's a Chihuahua, so there you go.
That's all the spider-legged Maltese wanted as well. And but we eventually actually got him out of the bed. But anyways, so then he became my soul dog, and I had him for 4 beautiful years, and he was the best creature. So adopt senior. You could still
be the best thing you ever do.
Yeah, honestly, I can't imagine not having him.
Maybe that's what I could convince Ryan to let me do. Because I want another dog so bad.
Chickens, old dogs, and Koopy.
And Cooper, who's the old dog too. And Cooper would probably like that better than if I got like a young dog.
Yeah.
Who's like running around everywhere.
Yeah, I think so.
I should get him a crusty Chihuahua.
Yes.
Who's 14.
Yeah. What are you going to name it?
Ooh, I don't know. I got to think about that.
You got to have the right vibe for the right
I got to meet him first.
Yeah.
Okay, let's do questions. Are you ready? She only knows what one of these questions are, but okay. So, do we want to get anticipatory grief? Do we want to do that first, or do we want to do that last? Let's do it first.
Do it first. Whatever you want.
Okay, yeah. So Nicole said, "How do you deal with anticipatory grief for your patients?" So Nicole's also a vet.
Oh, that's great.
So she's asking about that, but I think we should just talk about what is anticipatory grief for pet parents too.
Yeah. So it's a really great question because so many of us experience it, but we don't even know it. So anticipatory grief is this fear of losing something that you currently have in your life today. And for us as pet parents, and especially as senior pet parents, we tend to have this really big fear of losing this animal that we have in our life that we love so, so much. And we can't imagine our life without. And for many of us, we've already had this pet for a decade or so, right, in our life, if we're lucky enough. And so we really don't remember life before them. And so we develop this fear. And what this can result in for a lot of pet parents is anxiety, constant repetitive thoughts around it. And so we have this grief that we literally experience prior to losing this thing. And it's crazy because you have the thing in your life right now.
Yeah.
You have that
they're alive in front of you,
but you're already grieving the future loss of them. Mm-hmm. And that is really, really difficult. And more people experience it than I think realize it.
Yeah.
And I don't know if you have it with Koopy.
Yes.
I had it big time with Becca, and I actually have it with Twig, my senior at home right now. But the way that it manifested for me with Becca, who was my older Labrador that I had that lived to be 18, my cardboard, Arkansas, sorry.
Yes. Arkansas, I like that too.
Right. Stick around. I
gotta think of somebody I know, a woman I know from Arkansas. Well, hello, Arkansas. How are you?
That is a good name
along
for that.
Okay.
Yeah. All right. But for Becca, I had this tightness in my chest every time I looked at her, and I would look at her, and it was this tightness in my chest. What was happening in the back of my eye? I was like, oh my God, is she doing okay? Is she doing okay?
Yeah.
Like, I'm worried about her. Like, what if I don't have her? She looked old today. She's looking like she's hurting. Like, what are we going to do? And so that was kind of was running in my head, in my mind in the background. And that's how it manifested for me. But there's a lot that you can do. And I think it's a really great question.
Yeah. I think, and like you said, I think a lot of people don't realize what they're feeling is anticipatory grief. Like, I have many times had a client in front of me who's like spinning a little bit. We're talking about something, and like something that doesn't seem that sad triggers them, and they all of a sudden they start crying about what we're talking about. Yeah. And they're like, oh my gosh, I'm sorry. I don't know what's wrong with me. And I have literally leaned across the table and said, I know what's wrong with you. This is called anticipatory grief, and it's normal, and it's okay.
There's nothing wrong with you.
And it's normal. Like, I see this all the time. It's okay. Yeah. And, our pets are just like attached to so much life. Like my anticipatory grief with Cooper, of course, is about, like I said, like I freaked out about the cancer test, but I think Cooper has been part of our life through so many like big, terrible, wonderful,
right,
big life things. There's just, there's other grief attached to Cooper.
Right.
And so it's like that, he was our dog for these big things.
Oh yeah. You guys had him before
we got Cooper for
children.
Our 1-year anniversary of our marriage.
Right.
Yes. So yeah, I think anticipatory grief looks a little bit different for different people. But I think so many people go through it or are experiencing it and they don't even realize it. Yeah. And this is a good, I think, time to talk about pet loss community.
Absolutely.
So, tell us a little bit about that.
Yes. Yeah. So I co-founded Pet Loss Community with my friend, Dr. Lisa Littman. And what had happened was we had done this IG live, just an Instagram live at one point. And we had Dr. Katie Lawler on there, who is a therapist trained out of Stanford. And the three of us had gone on and we did this Instagram live just on social media. And within like 48 hours, it had like over 20,000 views on it. We were talking about pet loss on it and the grief that comes around it. And we had all these comments like, please do more of these. Like, I feel so alone, et cetera, et cetera. We realized that pet loss grief is really a grief that is not talked about enough and it has a stigma around it.
Yeah.
Right. And so we were like, wow, there's people out there that are hurting that really need support around this. And so we decided to form Pet Loss Community, and it's grown into what it is today, which is we have this amazing, talented team of mental health professionals that run these group support meetings, honestly, weekly that we have. And we've got these amazing pet parents that are going through this really tough time that come and they share their heart, and they share what their situation was and they talk about grief and they're not alone and we're not alone during it. And we always joke because I go to those grief support groups and they're smaller groups. I like to keep them kind of small so that people feel comfortable sharing, but you're also learning and like supporting one another. Yeah. It's really amazing. And they're run by our mental health team. But I go to them and our joke is like, we're like the hair club of America from like the 80s or 90s.
Yes. Yes.
And the CEO, the president, he would always go, he'd be like, I'm not just the president, I'm a member.
The best kind of president. Yeah.
That's me because I'm there too. So I go to the support groups.
It's for me too.
Yeah, exactly. So I go to them simply because, which is crazy because I'm an introvert. I don't really like to be around a lot of people for a long time. You know that. Mm-hmm. And so I thought that going to an online group support group would be terrible for me. However, it is not. It's not overwhelming for me, even despite, feeling like I don't like to be around people a lot, that kind of thing. So they've been amazing. We also have one-on-one support and we've got online support too. So it's a really great little place to go if you're feeling alone or sad
and great resources. There's resources about anticipatory grief. Is that what I'm experiencing? And how to sort of cope with that. And I think anticipatory grief sometimes produces pet owner clients who are paranoid about a lot of things. And, I think there's a happy, healthy medium of like being overly sensitive, to different things going on with your pet and thinking everything, we want people to notice changes and abnormalities, but then it can kind of cross a line into this sort of obsession with what's happening today. Right. And when we talk about this in lectures, when senior dog parents are they're caretakers for those dogs and they're doing a lot, that's a very big burden. Oh, yeah. And sometimes we in our profession, in the vet world, we help shoulder that burden because then those clients are relying on us to, okay, what does this mean? And this has happened and how do I do this? And we anticipate that and we expect that and we're here for that. But I just think all of those things are part of the challenges sometimes of having senior pets, and there's help and support for that. And I love what Pet Loss Community is doing. And I wish everybody knew about it. We have people that stay with us for like over a year. Yeah. So they talk about like the average time of grief that you have is generally about a year for someone. Yeah. Or that acute grief where you're really hurting. And it can go for longer for sure. Right. Grief never really leaves us. Right. You talk about this. Yes.
Because I know
I've been through hard loss, human loss. Yeah. And grief changes and never goes away, but it does change. And you
go around it is kind of what they say, which I think makes sense.
And I mean, I'm a very big advocate for therapy and counseling, and grief therapy is really important for anybody that's lost anyone.
Yeah.
But yeah, you do the first year. I mean, it's really hard.
It's miserable.
It's really hard.
It's miserable.
Yeah.
And one of our friends, so Adam Greenbaum is a friend of ours who's actually worked in the veterinary space with us and lost his dog Baxter, who's a Boston Terrier, about 6 months ago. And we're actually teaming up forces with him. He has a really great website with a lot of resources coming out called lovebaxter.com. It should be coming out soon too. So that's another cool place to go.
I'm so excited to see it.
Yeah. He's put a lot into it. So we're excited about that.
Sarah HW said, my trainer says I am walking my dog too much, but I let him lead the walks. Am I wrong?
I think it's a really good question. Right. And we already talked about how we think movement is so important, even for senior dogs.
And it depends. Like the trainer could be right.
Yeah.
Like how much are you walking your dog?
I need more context, right? Are
we need more information.
He's limp and he's sore the next day, then we're probably walking him too much, right? Because some dogs aren't going to stop themselves.
Yes.
That's the thing with like heat stroke. We talk about like dogs aren't going to stop themselves.
Right. 100%.
Right.
And this is why we also don't really like to free feed dogs, because dogs will eat themselves literally to death.
Right.
Cooper Brinkman included.
I have the funniest story. I
Tell it.
Dive into it. Okay. Well, this is before I was a vet. Okay. And this is probably a very Cooper Brinkman similar thing that happened. I had this beautiful brown chocolate lab. My parents had this beautiful
of course
chocolate
it's a
Labrador. It's a Labrador named Angelicus. And I was like,
Angelicus?
Angelicus.
Did your mom name him?
I think it was my dad. It was one of the two.
Okay.
Of them. I think probably one of them wanted to name it Angel. One of them wanted it to be Latin.
Angelicus.
And Angelicus was bored.
Okay. I love it.
We loved her. She was a beautiful...
Angelicus is a girl too.
Yeah, it's a girl.
All right.
Yeah. So even more confusing.
Yes.
So yes.
Okay.
But Angelicus was a chocolate.
I had a lab named Sandy growing up who was a boy. So there you go.
Sandy who was a boy?
Yes.
Oh, that's hard.
See? Yeah.
Yeah. I have had Sandys that are boys. And I'm always like, that confuses me.
I know.
Like, but anyway, so I think I was like 19 or whatever, and 20. My parents were like, we're going out of town for a night. You're going to take care of the dog. And I'm like, fine. You guys starve her and you don't let her eat anything. And I'm going to take care of her and let her eat as much as she wants when you're gone. They're like, don't do that, Monica. It's not really bright. And I was like, well, I'm young and I am not going to be bright right now. So
like I can eat whatever I want. Yeah. So can she.
So I had to go to work this next day, and I wake up in the morning. I feed Angelicus her regular bowl of food, and I put it up, and she's still going over there to look for food like a Labrador does. Okay. And then I was like, I'm going to fill like 2 giant bowls here for this dog, like way more, like probably like 8 to 10 times the amount Angelicus is supposed to be getting in that morning feeding period. And that was my like what I was defaulting to. So I did that. I go to work. I come back at lunchtime.
This is an interesting form of teenage rebellion.
Oh, yeah. You know what you think you know
I'm
better.
I'm going to feed the dog as much as
like
I want.
You guys starve that dog. I know better. Look at me. And so I come back at lunch to let the dog out. And what do I find in
Diarrhea
the house?
everywhere.
Diarrhea everywhere. There's diarrhea everywhere.
I literally have the same story about Cooper, except I didn't feed it to him.
You weren't rebelling?
He was a puppy, and he broke into... I had a cat named Charlotte, actually. I had a cat named Charlotte. I named her Charlotte because Ryan lived in Charlotte, and I was sad. So, but yes, he broke out of... It was when we got Cooper as a puppy when I was in vet school, and he broke out of his... I don't know what I had him in, but he broke out, and he broke into Charlotte's food, and he probably ate... 3 pounds of cat food as like a 12-week-old puppy. And he got such horrible food bloat.
These Labradors.
But I came home from vet school clinics and there was like a trail of diarrhea all through the house. I wish
I was gagging.
This was a different time, but if it were now, I would have the best content because there was just like a trail of diarrhea. We were in this tiny little house that led back to our bedroom, and Cooper, and I'm really mad right now that there's no video because Cooper was like laid out on the middle of the bed as a 12-week-old black lab puppy, and there was diarrhea just all over the bed. I mean, he was just like,
God.
He was covered in it. It was all over the bed, and you could tell he had just like had the squirts all down the hall, all over the bed, and then just like laid down, and he was just like, because he had food bloat too. So he was just like so full of cat food.
Did you kill yourself, young puppy?
Literally. Yeah. And I took him to the vet school, to the ER, because I'm like, do we need to like give him? Yes, they gave him IV fluids.
Oh my God.
Because he was like, he
was
couldn't breathe
yes,
because he was so full of cat food. And I kid you not, So after it was all over, take him home. And like the next day, he's trying to eat Charlotte's food.
Of course.
I'm like, you idiot.
You dum-dum.
And nothing has ever changed. He's 11 and
yeah.
So
same. Caution to everyone out there. Caution
all
to the young
19-year-olds
souls out
Don't
there that
feed your
think that their dogs their parents
excessive kibble.
If it's a lab, they're probably not being starved. They're probably just getting on a regular. Also, did we answer the question?
Not at all.
Okay.
So the question
Hopefully that was helpful.
Is the trainer right by saying the dog is walking too much? But the answer is we don't know, except
So we need
walking is not the same. I will say this. Walking is a great form of exercise as long as it doesn't worsen your dog's pain. So, and if your dog gets really sore from just walking, you need to be talking to your vet about why a dog should not be sore from walking.
Yeah.
And so if they are, then we probably need to talk about arthritis management. So yes, there would need to be follow-up questions, but your trainer.
That's a great question though.
It is a good question.
And her head's in the right spot, right? Like,
yeah.
Thinking about it like, hey, I know movement is good for this dog.
Right.
Like,
and also defer to your vet.
Yeah, absolutely. It's very individual.
Yes. Thank you, Dr. Monica Tarantino, for doing this episode about old dogs. I have a feeling the people are going to want you to come back so we can talk about more things.
I'll come back anytime.
And if you're a vet professional and you're listening to this, you can catch me and Dr. Tarantino sometime at a conference near you.
Please. We love to see you guys.
We'd like to do these lectures together. Yeah. So 2026, we're hoping maybe we'll be at some of the bigger conferences, but who knows? That's a long time away.
Sky's the limit.
I think I am doing a senior lecture at Nutramax.
Yep.
In October.
That's awesome.
So if anybody's going to be there in Orlando, I will see you there to talk about it. Okay, this has been another episode of the Dr. Molly Says podcast. You can find us on all podcast platforms. If you don't follow me at Dr. Molly Says, you should also follow at Senior Dog Vets and Senior Dog Doc, which is Dr. Tarantino's own profile, and Senior Dog Vets is the Instagram for the group that does the society. And Pet Loss Community, is that the handle on Instagram? Pet Loss Community is another you can follow. All right. Thanks, everybody. We will see you next week for another episode of the Dr. Molly Says podcast.
Bye.
Bye-bye.